would like to call upon the floor Professor Dr. Somashekhar, Chairman Medical Advisory Board, SGM Healthcare, GCC and India. And his topic is Present and Future of Robotics.
Good afternoon. Today I'm going to cover what is the present and future of robotics and what is the future in India and made in India, make in India, and for the world, how to look at the robotics. I bring warm regards. And initially we knew that a good surgeon means long incision, long cut, big ego, and especially more so in complex surgery. Then we realized there is a paradigm shift in the surgery where minimal access surgery through a computer assisted surgery started. So this is where the surgical excellency in the pathway and the tip of pyramid happened, where we don't believe in evolution, but human beings take revolution with technology to keep and reach the zenith of the pyramid of excellence. You know that way back in the year 2000, there was a platform from US which was launched. In India, the first one was in December 2022. Even though there are so many systems in the world, number of systems in India is very less and poor because of various factors, not accessible, very expensive system, very expensive annual maintenance cost, instrumentation cost per surgery, and the capital cost to acquire. And that is why there are very few robotic surgeons who are trained and few number of robotic surgery that is done. And you know that initially it started in cardiac and thoracic, then came to uro, then gynec, and then to general surgery. And initially, urology, oncology used to be number one. But now we know that the trend has overtaken totally. In the world, if we have, one robot for 30, in India, the number is very, very poor because there are key barriers for the access to robotics, training, cost, and procurement and patient. Too big, too expensive is very tough. And then we need to have an affordable system which is required, but a high class quality. So this is what is the current clinical use, but very tip of iceberg. Very few patients, not more than 1% of the eligible patient who needs minimal access surgery robotic are undergoing in India and the world. Most of them are undergoing open or lab because of the various costs. However, in India, we are somebody who sent more than 200 satellite in one rocket. We sent to moon at a very low cost. And we conducted a Pokhara, and then we have using nuclear technology for peace purpose and energy. So we are the superpower in getting the technology, and yet for a long time we couldn't get the best robotic technology ourselves. All of you know that this is Professor Dr. Srivastava. He did the first robotic surgery in Escort, which was being watched by then our most honorable President Abdul Kalamji, along with Naresh Trehan, and it was a robotic surgery first ever done in India. And then there was more than so many systems. In the world, there are more than 6 to 7, 8,000, but in India, fewer than 150 systems are available. And now, as you see, it is not just urology and gynec, but general surgical procedure, ventral hernia, complex other procedures have also overtaken. And now it is robot is not just for elite oncology or urology or top, but for gynecology, general surgery, hernia, complex gallbladder, various other procedures which is available. But in India, the problem is surgery is out of pocket expense for many. Robotic surgery adds extra 1 to 1.5 lakh, which over and above the open surgery, which most of the patients don't afford. And most of the patients in India pay self-pay. Insurance sector is very less. And even then in insurance, there is a lot of problem in reimbursing the robotic. A lot of patients can't afford this. So we need to be a model in the world of technology and build our own. So that is where we understood that if we can think local and then made in India, make in India, Indian solution for Indian problem, a robot made in India for the world, not that West looks, East looks West, but the West looks to East to India. That is when Professor Dr. Srivastava came back from US and built this SS innovation and made a fantastic made in India robot for the world. So there is a global acceptance of robotic surgical procedure across the world because there is a faster recovery of parent and then less pain for the patients who can actually come down. And another thing, most important thing is there is a better screening, reduction in the infection for people, and there is a very minimal blood loss. and small incision, better survival. So despite this, most of the global market penetration is very less. A country with 1.4 billion, 70,000 hospitals, we have less than 200 robotic system and 1% of the patient only do because of high cost, cheap learning curve. That is where there is a need for making an affordable, advanced, accessible robotic system. That was the vision of SSI from Dr. Srivastava to create a new technology, advanced system that would surpass the existing surgical robotic system, be very cost effective, yet be a world class system and benefit more and more patients, not just in metro, across the world, first tier city, second tier city. The advantage of SSI Mantra robotics, ergonomically surgeon is sitting straight and operating, not bending down. Hands, feet are ergonomically sitting. It has got a 4K 3D high resolution system. You know that most of the other robots don't have 4K technology as of now, but SSI Mantra has it. There is a telementoring capability you have all seen recently. Dr. Srivastava sitting in Delhi in one place and doing a surgery on a pig's heart in the other. So telementoring possible and telesurgery possible. Modular design is available with either 3-arm, 4-arm, 5-arm individuals. Multi-speciality use, cardiac, GI, pulmonology, urology, gynae, general surgery, breast, robotic, oral, everything. Highly cost effective. Per procedure cost and maintenance cost and procurement cost is less than one third of any other competitor. So you can see that this is one of the robot which are individual card. 5-arm robot if you want. You can use 3, you can use 4 or you can use 5. Ergonomics is very good at the surgeon command. Large monitor. There is another monitor with a touch screen. Head tracking, eye tracking system for the safety. Large 3D, 4K monitor with 3D. Not only you see 3D, your assistant sister, everybody sees 3D. In most of the other platforms, only surgeon has a benefit. Assistants struggle to put a stapler, assist because they see 2D with a bulky arm. But here, in SSI Mantra, both the assistant, sister, you, everybody watch 3D technology. Advanced console ergonomics, very user-friendly hand control. A palm gripper is available, even a finger gripper is available. Clutch button, pinch button, all are available. And there is also equally distributed control on the foot and the hand, so they are not overburdened. So what are the technological attributes? It's an open face ergonomics, so you can communicate with the patient well, relate attendants well, patients well, and your surgical attendant colleague and your assistant on the bedside. Active visibility of the hand control, foot control for the entire operating room. Large 32-inch 3K 4D monitor. And also a DICOM application, TIPRO application. You can connect a TIPRO, you can connect a CT scan MR, you can connect a hospital information system, you can connect an ultrasound, you can connect a 3G ICG enabled. Patient card is modular. You can use 3-arm, 4-arm, 5-arm based on your surgery requirement. Freedom of patient docking, small individual card footprint, not bulky, absolute stable parking clocks, and advanced touchscreen control. So the SSI technology attributes are flexibility of card, modular design and multi-cards. And vision card is state of art. It has got a Olympus 4K HD with the Endorist camera. Now you can turn the camera with a side-wide movement also available. There is an Omni 3D HD multimedia recording which comes built-in for streaming platform, articulated endoscope and camera control, universal safety precaution, and pre-operative guidance software and UPS battery backup in case of emergencies, which is very good and which enables you. And the instruments, there are a lot of other instruments. There are 8mm Mudra instruments, automated anastomotic connector for coronary bypass, multi-5 clip applicator, robotic harmonic now, cardiac stabilizer robotic. It is amenable for uro, gynae, general surgery, cardiac, pulmonary, bypass, thoracic, head and neck, breast. Very low system procurement cost, low maintenance cost, low instrumentation cost and low per procedure cost which patient can do. Olympus 3D 4K articulating, very few people have articulating camera. Even you can turn sideways also. And now ICGM stapler are coming in next 2 months and already SSI Mantra Robotics Harmonic is available. And there is a pre-operative application for logging, patient data input, port instrumentation suggestion, procedure cards, patient positioning, IA information, card placement, arm docking, all these are available. And there are a lot of instruments which are available called as SSI Mudra intrasurgical. 40 plus instruments are available, including SSI harmonic, multi-fire clip applicators, and various instruments, micro instrument, black diamond, spatula, micro instruments for suturing, cardiac, vascular, transplant. This is one of the very unique thing, SSI multi-fire clip applicator, multi-clip applicator in the fifth time, you can come fire and park it out, go back, come back, so there is no wastage of time. Now the vessel sealer and robotic staplers are being introduced. There is something called as SSI Maya, where you have an AI and the holographic anatomy, virtual surgery training, telemetry, AI-based DICOM, and head-mounted peripheral view which you can use, which is a high definition and natural reconstruction of a 3D image to the brain using the information. Clinical experience, it has currently in India more than 850, close to 900 to 1000 SSI mantra surgery has been done. In robotic urology, prostatectomies, radical cystectomy, intracorporeal polycystectomy, adrenalectomy, pyeloplasty, pediatric urology, adult urology, and robotic partial radical nerve preferring prostatectomy. Multiple gynec procedure, both benign and malignant, radical hysterectomy, sacrocolpopexy, endometrial cancer, cervical cancer. General surgery like cholecystectomy, ventral hernia, bilateral hernias, hepatobiliary surgery, pancreatic surgery, gastric bypass, colorectal surgeries. Head and neck surgeries, transoral TORS, robotic tonsillectomy, larynx, thyroid, parathyroid, thoracic pulmonary lobectomies, vent resection, pneumonectomy, decardiation, multiple complicated thymectomy, esophagectomy, bull leg. In the cardiac, total endoscopic coronary artery bypass, TCAM, mitral valve surgery, tricuspid valve surgery, hybrid, Cox-Maze procedure, ALVVH. This is the only robot in the world which is approved and amenable for cardiac surgery. The instrumentation is available, the atrial stabilizer is available. So these are more than 850, close to 1000 surgeries which are done. Not a single device-related adverse effect has been found in any of this real-world surgery, 850 plus done. I myself has done very high volume, complex surgeries, never had any problem. So the training approaches are didactic module training is there, hands-on training is there, trial training for the entire team, in-person proctoring, on-site SSS support additionally, telemetry, and remote proctor in complex cases available. Also now the future perspective is mantra and robotic arm for diagnostic and therapeutic telesurgery, and then a portable surgeon console, single port robotics, system integrated medical imaging, and all surgical systems are available. And there is a 10-port attachment. I use that for ultrasound, laparoscopic ultrasound, HIF system, ICG machine for FLNB and vascular edit. And intraoperative telemetry, live holographic, you can wear it and do, which is going to be introduced shortly. And virtual surgery operability capabilities available in SSI Mantra. And a robotic endoscope where if you are doing a complex laparoscopic surgery, the camera alone can also be controlled completely by robot. You can see that right anastomos, ureter, gonadal separated, ileocolic is cut. Now ileocolic pedicle is taken, then the right colic, then Henle trunk, gastroduodenal trunk is taken. Then we mobilize the springy fracture, create a window with and C loop of duodenum completely, and colonic attachment is completely released. Now the robotic SSI Mantra harmonic is available. Now you can see that I have done an intracorporeal anastomosis. I fired the stapler. Second layer with robotic SSI Mantra. I am doing a limbar suture, hand sewn, and this patient went home in 48 hours. So most of the complex surgery, there is a lot of publication we have done from our group in a world famous International Journal of Advanced Robotic. You can see this is a publication on a robotic SSI Mantra LIR. This is on the right colon and the endometrium, and a lot of publication is done. So in conclusion, it is very important to understand the future depends on what we do in present. Best robot in India, made in India, Indian solution for Indian product, made in India, for the world, high quality, multitasking robot, very short learning curve at affordable price to all the patients. So this is a revolutionizing robotic surgery for multi-speciality available. Thank you very much. And if